Hello, my topic is antibacterial envelope to prevent cardiac implantable device infection. Definition: it is estimated that 1.5 million patients cardiac implantable electronic device (CIDS) worldwide every year, despite the use of various antibiotic prophylaxis and advocacy of best surgical practice. The infections after placement of CIDS a major complication and are associated with substantial morbidity, mortality, and health care utilization. An absorbable multifilament mesh envelope is able to improve CID stabilization in the subcutaneous pocket and to elute the antibiotics minocycline.
Number 7. Antibiotic envelope for cardiac implantable device infection prevention.
Pacemakers and defibrillators are life-saving electrical marvels, but do not come without risk. Infections occur in 1 to 4% of cardiac device implantations and can lead to a 25% one-year mortality rate. Treatment costs average around $60,000. Until now, giving the right antibiotics right before the procedure was the best and only proven way to prevent infection. Despite this, infections continue to occur. The recent innovation of an implantable antibiotic envelope ensures delivery of 2 antimicrobial drugs locally in the pocket for 7 days after implantation surgery. The week-long release of the drugs minimizes the risk of infection. The absorbable envelope received FDA clearance in 2013, but healthcare professionals were awaiting results from the landmark worldwide randomized RAPID trial. The findings, published in March, show a 40% reduction in major infections, making cardiac implantable device procedures safer for patients.
Application in medicine. The T-White-RX envelope is a absorbable single-use envelope designed to hold CID when the device is implanted in the body. The envelope is constructed from a multifilament knitted mesh and coated with absorbable polymer mixed with minocycline, which elutes the antibiotics into the local tissue for minimum of 7 days. The envelope is fully absorbed in approximately 9 weeks.
Every year, more than 1 million people worldwide receive an implantable heart device like a pacemaker or defibrillator. These complex gadgets can be life-saving for some, but surgery to implant or upgrade them comes with a risk of infection.
Infection is not something you can treat with antibiotics alone. It's the consequences of the infection that makes us really feel very concerned about it when it happens.
A bad infection can lead to invasive surgeries, long hospital stays, and even death. Typically, doctors give patients antibiotics before the procedure to prevent infection. But now this antibiotic envelope can also be used during surgery. It's made of an absorbable mesh that wraps around the device and stabilizes it. In a study of almost 7,000 patients, infection rates dropped by 40% when the antibiotic envelope was used.
To prove that there's an additional intervention, additional therapy that you can provide as a preventive measure and was able to cut down the risk by 40% is something really remarkable.
The envelope is coated with 2 antibiotics, minocycline and rifampin, which are continually released over several days. It fully dissolves in the body after about 9 weeks. A simple innovation that gives patients peace of mind when they need heart surgery. I'm Marty Salt reporting.
Pros and cons. Pros. T-white RS will reduce the incidence of infection in patients who have received CIDS. Intravenous administration of cephalocin before the procedure of infection by 81%. Cons: T-white Rx is not available is in all countries and where it does have a very high cost. Use applied in Ecuador. In Ecuador, heart diseases are very common. They are the first cause of death in the country. In 2017, they caused 7,862 deaths. However, in our country collecting, CIDS cost between 17,000 to 50,000, causing few people to have access to them.
Your heart pumps oxygenated blood throughout your body. Rhythmic electrical impulses inside your heart cause its muscular walls to contract, ensuring your heart beats steadily. If problems occur with your heart's electrical system, you may develop an abnormal, potentially life-threatening heartbeat called arrhythmia. Your doctor may want you to have an implantable cardioverter defibrillator, or ICD, to restore the heart's normal rhythm and prevent sudden cardiac death. During the procedure, your doctor will thread a small wire through a vein until it reaches your right ventricle. The wires continuously monitor the heart's rhythm. After verifying the wire is in the correct location and works properly, your doctor will attach the wire to the ICD generator. Then your doctor will insert the ICD device under the skin of your chest below the collarbone. The battery-powered ICD constantly monitors your heartbeat using a computer. If a life-threatening arrhythmia occurs, the ICD delivers an electrical shock to your heart, resetting your heartbeat back to normal. The ICD can also be programmed to pace the heart and restore its natural rhythm.
Conclusion: adjunctive use of an antibacterial envelope results in a significantly lower incidence of major CID infections than standard-of-care infection prevention strategies alone without a higher incidence of complications. Thanks.